Well, hello everybody. I am live right now. I'm inviting Dr. Priya Mistry here. So we're going to be talking about the neck and its relationship to jaw pain. And there she is.
Hi.
Hello there. How's it
Good.
going?
Good. How are you?
Good. I'm glad we finally got this together. We've been trying to do this for months.
I know. It's been a journey. Thank you for being patient with me. Both our schedules are just so busy, but it's good
Yeah.
to see you.
Yeah, yeah, absolutely. Good to see you too. So I'm
Yeah.
excited to kind of discuss TMJ, the jaw, the neck, the relationship,
Totally.
the different habits, the bad
Yes.
habits that cause the pain. So just a little bit about you. Where are you based out of? Like, just what do you primarily do?
Sure. Yeah. So I'm based out of Vancouver, Washington, which is actually just 10 miles north of Portland, Oregon. So a lot of people think
Okay.
it's Vancouver, BC, but it's not. Um,
Okay.
so yeah, just 10 miles north of Portland, Oregon. I have a TMJ only practice and I am a dentist. So I'm a TMJ dentist
Mm-hmm.
and I take care of those with TMJ problems. So that's a little bit about me. I've had this practice. I bought it in 2021, but I've been doing TMJ only since like 2018. So I love what I do so much. And what about you? Tell us where you're located
Yeah.
and a little bit about you.
Yeah. So I'm in New Jersey, and it's funny because you say I'm a TMJ specialist and I'm a dentist. People don't understand what TMJ specialist means
Yeah, they
because it
don't.
can be across so many different things. So I'm a
Right.
TMJ specialist physical therapist,
Sure.
and I'm here in New Jersey. I've had my clinic for 5 years. I've been doing this for about 10 years, head, neck, and jaw, and it kind of goes into the topic for today. Why head, neck, and jaw? Because it's also interrelated. It's not there are cases, as you know, a TMJ joint issue, which is
Mhm.
a problem in the joint.
Yeah.
I think people forget that the TMJ is a joint. There's just like your shoulder joint, just like your knee joint. You can have a joint issue, but then there's jaw pain. And that could be a whole different thing because there can be so many causes of jaw pain, even in the absence of TMJ injury.
Yes, totally,
Right.
totally. And I think the way I sort of break it down for my patients is there's a problem in the joint, there's a problem in the muscles, or there's a problem in the muscles and the joints.
Right.
Right. And that's
Mhm.
really like what it comes down to. It's like muscles, joints, nerves, how everything works together, and then how the teeth come together can play a role too. So yeah, I
Right.
know that for me, I see a lot of my patients come in with forward head posture. So
Yeah.
they come in and I look at their profiles and they're like this.
Yeah.
And the every inch that the head is forward from ideal being like the ears in line with the shoulders in line with the hips. Every inch that is forward, that's an additional 10 pounds of pressure on our necks, Joe,
Right.
right?
Right.
And so we do talk about posture a bit, but I am not a posture expert by any means. So I was going to kind of hand it off to you, like
Yeah.
explaining forward head posture, how it
Yep.
happens, what you can do about it. So I'll
Yep.
hand that off to you.
So just speaking specifically at forward head posture, neck, and its relationship to, let's just say, jaw pain. There's a few different ways. There's the first piece I would categorize as the mechanical piece, the relationship. So, as you know, you have muscles that come from down here on the collarbones, go up to the hyoid bone in your throat, and then they connect to the jaw. And these same muscles also connect to the bones right behind your ear on the skull. So, as your head comes forward, some of these what are called the suprahyoids, which meaning above the hyoid muscle, infrahyoids below. As you come forward, they start pulling the jaw back. So they're actually repositioning the TMJ.
Totally.
So I have my little model here that everyone knows about. But they actually, as your head slides forward like this, the actual TMJ, it starts
Yes.
sliding backwards. And that's where things can end up in your department of disc issues, joint issues, inflammation, synovitis, arthritis, all that stuff. So
Totally.
it actually impacts the joint. And a test for anyone at home who wants to try, which I always think is fascinating, if you stand up tall and chatter your teeth like this, and then slowly progress forward as you do it, like that,
Oh,
you actually feel the contact, your teeth move backwards in your jaw.
Joe,
And
you're a
so,
genius. That's the easiest way to explain that.
and so once you feel that,
Yeah.
that's it. The case closed,
Yes.
right? Like you completely understand it. So that's one piece of it. The other thing is that another major piece is the upper cervical vertebrae up here, the three upper cervical vertebrae.
Mhm.
They go into this nucleus where the trigeminal nerve, which is the nerve for the jaw, actually meets it. And so very often if there's compression and irritation here, kind of like a by mistake, and it's kind of like almost like a fault in the system, you feel pain in the jaw. And
Mhm.
some of the nerves that control the tongue also go through there. So sometimes we'll have people who turn this way or tilt this way and their jaw starts lighting up. And it's not a jaw issue at all. It's just a nervous system, kind of like a trick that goes on. So those are some of the more common ways that I see this direct relationship.
Mhm.
People come in all the time. They're like, I have TMJ. And then we look and I'm like, this is a neck problem. This has nothing, your jaw
Yeah.
is completely fine. I'm sure you see that all the time. Like you have to just refer people out.
Oh yeah, yeah. We work with body workers, and then there's also like referred pain, period, right? So it's like the SCM can refer pain
Yeah.
into the jaw. Like there's so many
Mm.
different
Yeah.
neck muscles that can
Yes.
refer pain up into the head, the face, the jaw, whatever, so I do see that a
Yeah.
lot. And it's all about like figuring out where the pain is coming from and how best to treat it. And it can be a challenge, but for me
Yeah.
it's like a fun challenge. It's like every patient's a little
Yeah.
bit of a mystery. Yeah.
Yeah. I agree. I think it's also kind of I hate to say fun, but it is fun because it's like a puzzle, and
Yes.
so and most of the cases are not straightforward.
Right.
And the other thing to mention is that if you like even talking about clenching, you could not have a TMJ joint issue,
Yes.
and then over time, all that clenching, the synovitis, you can actually start degrading the
Yes.
joint. So you can now convert
Develop
in,
one.
convert
Mhm.
into that. Um,
Totally. Totally.
so I'll go into a couple things that I find solutions, but before I go into that, like, do you find any habits or anything that more directly impact either the muscles or the joints
Yeah.
that people are doing, maybe they don't
Yeah.
realize?
I think one big one that people don't realize is a lot of people sit in front of the computer for work, and
Hmm.
many people have two monitors. Even if you have one and it's off to the side, constantly having your head turned to one side or the other is not good, or leaning forward. I think we all kind of lean forward when we're looking at a computer screen.
Yeah.
And, trying to really maintain good posture when you're in front of the computer can be a hard one. And another thing that people do in front of the computer a lot is rest their fist or their
Mm.
hand against the jaw,
Yeah.
and that puts a lot of lateral pressure on the joints,
Hmm.
and that can lead to a lot of strain in the jaw joints. They are not built for a lot of side to side movement. They're built for
Hmm.
forward and back
Hmm.
and up and down, right?
Right, right.
And so many people will put that lateral pressure when they're sitting at a computer, or even when they're sleeping, they'll put a lot of pressure on the jaw. So those are
Hmm.
things I always encourage people to stay away from. Opening things with your teeth, get some
Yeah.
scissors. You don't need to do that. Yeah. Like,
Yeah.
it's just, that it's not meant to be used that way. The
Right.
teeth and the jaw joint complex. And then I think some other ones are like drinking too much caffeine.
Mm.
So like 1 or 2 cups of coffee a day is enough. I had a patient that came in and says she has 12 to 15 cups of coffee a day,
Hmm.
and her muscles were just in so much spasm. And I said, I can do only so much for you, but we've got to change some of these home habits. And she was not willing to. So, I mean, there's
Hmm.
only so much I can do because too much caffeine sort of dehydrates the muscles. It puts them into spasm. It makes us like jittery,
Yeah.
anxiety. And many of us tend to like clench more when we're like
Yeah.
that. So,
Yeah.
yeah, those are sort of the ones I see. Did
Yeah.
you want to touch on habits or kind of go back to the forward head posture?
Yeah. I mean, we could go back to the forward head posture. The other thing is like when I'm working with people, some people are in what I would call a postural bucket, where it's real simple. They have pain, they sit up tall, and they feel their pain goes away. It's
Right?
and so that's number one. But then there's a lot of people, I would say more people, who they fix it and then they're like, yeah, I feel a little more comfortable, but the problem doesn't go away because at that point, they've been in that position for so long that the joints are actually shifted in like a tighter position,
Yeah.
or they've compensated and started using their shoulder differently, or the jaw, there's so many muscles in here, the capsule, it starts shifting in a certain position. And that's when we have to look at specifically how their jaw is moving,
Yeah.
how their shoulder, the neck, and then use specific movements, which we would have to go like a little, like probably deeper than we can right now to like go into that whole process. But just so most people, posture is a starting point, but we have to actually like use force and reposition over and over and over
Yeah.
throughout the day, like corrective movements they're called. But simple tips are what you were talking about, the other layer, which is trigger points and muscles that refer there. So it's like you have the joints, which we talked about, the jaw joint and the neck, but then there's also the muscles, which is another layer that of
Mhm.
like complexity to it. Um, but a lot of the trigger points set in after being in the same position like 30 to 60 minutes. So even changing positions every 30 minutes is an important one. Even if you're sitting, you just
Mm.
stand up, doesn't matter what you do, just move around for a minute and then go back to your habits. That's a good one. Um, Everyone knows you need to have an ergonomic workstation. That's kind of common
Yes.
knowledge. And you shouldn't be looking down at your phone. But definitely change your position every 30 minutes. When it comes to a pillow, for people who have jaw issues, sometimes I tell them to tilt it down so that the edge of it isn't right on the jaw. So they're kind of on a slope here and the jaw can
Yeah.
float a little more.
Yeah.
Um, yeah, that's an important one. And then repositioning, just a simple starter is just getting that head back, but every couple hours bringing it back again.
Yeah.
Because you could have the best routine, like you could have the perfect routine to make your body put it in better position, and you do for 30 minutes in the morning, but then the rest of the day is just gonna hammer you and
I
just
know.
life just so that's really what you have to compete against. And that's why instead of doing this long routine once a day, it's 30 seconds every couple hours, just the right habits sprinkled in throughout the day, and that's what like really moves the needle is what I
Right.
found.
Yeah. Yeah, totally. I
Mhm.
totally agree with that. And I think it's I think a lot of us get so caught up in our work days. And I used to edit, for example, I used to edit all my own YouTube videos
Mhm.
like a crazy person, but I would sit like this.
Yeah,
And I'm like, what
yeah,
am
yeah, yeah.
I doing? Like I
Yeah.
talk about this all day. So
Right,
I would
yeah.
like immediately like go back. But I think it's so easy to get caught up in these habits and we don't even realize we're doing them. So I think what would be cool for our next Instagram live is if we showed some simple like
Yeah.
corrective, what did you call them?
Yeah.
Corrective.
Yeah, corrective
I love
movements.
that.
So it's
Corrective
more
movements. And I can,
specific.
yeah. And then I can show some simple self massages. And I think that can help people, just at least relieve some of the pain
Hmm.
throughout the day. So yeah.
And
Were we going
what
to talk about anything else?
No, but I was just gonna say that the other thing, like I focus a lot on, the joints and the movements and finding the stuff that we're talking about. But just the nervous system is the other piece of it,
Yes.
right? So that controls all your muscles. There's no part of your body that's richer in nerves than the head, neck, and jaw. And so and the thing is, as you start, the longer you've been experiencing pain and you start getting into like sensitization and central sensitization, things stop making sense. Like, under normal circumstances, like if you have a problem in this nerve, you're going to have pain here.
Mhm.
The longer that you've had pain, now it starts actually jumping because there's these little cells in there that start. So you can have a problem here, but pain here because the nervous
Yeah.
system stops working properly. And that is another layer of complexity. So addressing the nervous system and addressing the joints and the muscles specifically over time
Yeah.
makes a big difference. So we can
Yeah.
go, I mean, we could do so many of these.
I know. Well, the
Yeah.
nervous system, just to kind of piggyback off that real quick, is
Yeah.
really interesting that you bring that up because I just started a new type of therapy called disclusion time reduction therapy, and it just focuses in on the bite, and the
Mhm.
bite is often a cause for TMJ, TMD. Not always. I'm not saying it's everything,
Yeah.
but the back teeth have peripheral nerves that actually synapse directly in the central nervous system. So if
Mm.
those back teeth are taking way too much force or rubbing against each other in side to side movements, it can keep the central nervous system sensitized, overly sensitized all the time. So we
Hmm.
do micro adjustments on the teeth, kind of like filing your nails. It doesn't hurt, you're not numb, it's barely anything. It's like a light dusting.
Okay.
And what it does is it lowers the threshold of excitation of those nerves, and then we see pain start to come down. It's really neat. Not everybody's a candidate for it. The
Ri-
teeth have to fit together a certain way. There's like,
Right. Right.
but
Yeah. Of course.
you said it just ties right in with what you said with the central nervous system, right? So
Yeah.
um, really cool. Yeah, we could do a ton of these. This is
Yeah. Yeah.
fun.
Well, and moving forward, we could do specific topics so we could actually just get deeper into one thing. It'll
Yes,
probably be more helpful.
I think so too. I think so too. Well, this was awesome. I'm glad we did
Yeah.
this. And
This worked out well.
to the audience, stay tuned for our next ones. We'll try to let you guys know a week or so in advance, and just how we did. We'll announce it on IG, and we'll do it again.
Yeah. And we could put polls in our stories or questions so they could submit like what you would want to really hear about.
I love it.
Yeah.
And I think you should move here and work with me and my patients, Dr. Joe.
Yeah, it's funny. I have a cousin out there, so maybe I'll stop by the clinic.
Come
Yeah.
visit. All
Okay.
right. See you all later.
All
Thank
right.
you.
Bye. Thanks for joining.
Bye.